Join us as we dive into Dr. Sangwan's pioneering work at LV Prasad, where courage met curiosity. Research and teamwork brought breakthrough treatments like SLET and 3D printed corneas to life, and how mentorship fuels innovation. Dr. Sangwan, you're known for taking risks all through your career. Can you call out few points which are important while you took risks?
Well, for a long time, I did not know what I am doing is risky.
Okay.
I had really no understanding. When I got a little more wiser, then I started understanding it's called risk taking.
Okay.
Because in a village, you do things for your survival.
Right.
You do things that how I make life better for myself and for my family. So I did not think that these are risk taking. But now, yes, I can say yes, these are risk taking, and I don't feel that it is a big risk. I said this is the natural way of doing it.
So your first risk is when many of your friends told you, why do you want to take ophthalmology? You could have taken another such specialty. So that's the first risk, you believe?
Yes, I mean that was because I was also the topper of my batch in PG entrance exam, and then I could have gone to pediatrics or surgery orthopedics, but I somehow wanted ophthalmology, despite knowing that no one have a good opinion. So at that time I didn't understand, but now I understand. If a lot of people are saying no, it's not a good idea, then I said this is the good idea.
Okay. What is the next risk that you took after you took up ophthalmology?
After that, the going to LVP as a fellowship, it was the biggest risk. By then I was married, had my wife was on family way, and that was, I think it was the biggest, because we both cried that, how she will live, just got married. My parents-in-law, my parents, everyone thought that it's a crazy decision. And my professor discouraged that, no, it's not a good idea. It's a private hospital. Why are you going? So I think that was the biggest risk.
And you flew from there in flying colors, right?
Yes. I mean, somehow when I went for interview in LVP, I felt this is the place I belong. I must come here. If I am not selected first time, I'll come second time. I'll keep coming.
So what is that makes you feel that this is the right place when you are taking risks?
You don't, first of all, when you're young, especially when you're a resident or a fellow, it's very difficult that there's too much of noise in your head. But slowly now I can articulate how I made these decisions even at that stage. Somehow I have this connection about myself that I'm able to feel when these thoughts come. Like when I was leaving LVP, it was a big decision again and a big risk. Everyone told me it will not succeed, it's a stupid thing, you should not do. So what I used to think, okay, the idea of going to North comes, I feel very energetic. If it did not, as idea of staying there, then I didn't feel very energetic. So to me, I think this is a very good test of yourself.
Okay.
What is the kind of energy you feel?
So while you were in LVPI, I read a story that in a bus accident, a blind person was being treated by nobody else, but you took up that. Even that was a big risk, right?
No, that I don't think a risk at all. Even those things I do even now, I don't think that is a risk at all. Because to me, when I am a doctor and I know that if I can make a difference, I will do that. Not because I want to protect my name. My thinking is that how can I help him? If I can help him, I don't worry whether the outcome will be even negative.
So you don't believe it a risk that nobody else picked up that case and you picked it up?
I don't think that's a risk at all.
Oh, wow. Okay. So should I then call it that it's courage that I will be able to make a difference to this person's life? What may be the outcome? Because
I don't think even it's courage. To me, it is a human connect. If I am able to connect and the patient understand that what I am trying to do, and which I try to make them understand what we are trying to do, I express my concerns, I express my fear that कि ये fail हो सकता है, ये नहीं आएगा. तो patient ही मुझे सिखा देते कि सर अभी भी तो नहीं आ रहा ना, क्या जाएगा अपना?
Right.
क्या lose होगा? तो मुझे नहीं लगता ये risk है.
Great. Okay. So you then decided to move at Harvard for a couple of years. By doing still very good practice, you ended up going to Harvard. What was the calculation behind that?
No, going to Harvard, at that time, I just finished my fellowship in LVP. And in fellowship, what I saw, there are certain type of patients who have systemic disease, and that affects eye also. But most people don't understand, and the specialists don't talk to each other. So they send the patient to rheumatologist. Rheumatologists say, oh no, this disease is not active, you deal with eye. So I realized in my fellowship that both have good intention, both professors, but both don't know how to treat. So I decided if I want to treat these patients, I want to train myself in that area.
Okay.
And then I looked for who is the best in that field. I discovered there was one Dr. Foster in Harvard, and I said I need to go to the best. If I want to deal with these patients, I want to go to the best and learn from the best.
So you were also, while practicing, found gaps where there are kind of patients and how they can be treated, and you took a step of going out of India and learning and coming back, right?
Yeah.
So again, many may have told you to be there in US and practice there. You may have thought, I'll be only a doctor there. Why can I not make a better impact in India? So coming back to India, your views on how did you handle?
Again, for me, it was not challenging. Partly because my wife, Vandana, was very clear. Both of us very clear that we are here only for learning. We are not going to stay here.
Okay.
So the decision was not difficult. But coming, where to come? So I tried I interviewed with many different organizations, but I felt that the best place will be LVP. And Dr. Rao had given me open offer. He said, if ever you come back to India, LVP is waiting for you.
Okay, great. So, doctor, in the whole journey, couple of times you have spoken about the support from your wife. How important is family support? We all know, but can you call out a couple of points where you think that no, your wife stood by you in any decision that you made, and it's been really positive for you today?
I think the first she understood when I was going for fellowship, and we were just newly married, hardly 1 year. And then I went for interview, and she was understanding that, okay, what I'm trying to do. Even though internally she thought that if maybe you will not be selected. And then she'll be very happy. Okay. But since then, I think she has always been standing by, and that did not stop me doing what I want to do.
Great. So, with family, there is also a need to have a sense of stability, right? And with all these courageous decisions that you have taken, how stability is something that you also planned, or it happened the way you wanted it?
No, it is planned. Because see, like what happens is that you have to understand in a given situation, you need to understand the risk and benefit, or what the fringe benefits. Say for example, when I wanted to come to North India, and I decided, okay, I'll go by 2015. But that year my son got admission in BITS Pilani, Hyderabad. So my wife said, no, we will not go now. We will stay till he is studying. So I said, okay, I'll realign, and it's fine. It's fair enough. There's nothing that So similarly, like if you are working in a team, it is far more dangerous to disrupt the team because of your ego. You have to look at the benefit, what the team is providing. So I look for both the aspects.
Let me ask you this one point, that in all your journeys, you've looked up to certain mentors, right? Do you want to call out a couple of names who made a real difference to you?
I think the biggest and the most important was Dr. G.N. Rao, because for the first time as a young medical student who grew up with only belief that if you know someone, then only somebody will help you.
Right.
Here is a person who has no interest, who doesn't know you, only thing he looks for and merit and a potential.
Okay.
So biggest impact I had during my fellowship with him.
So here, while I talk about merit and potential, in the team that is comprising who's working with you, how do you judge whether they have potential or not? Is it that you give them certain difficult cases, or you jointly work with them on difficult cases? How do you go about it?
No, I think it's an ongoing process. I have a knack of understanding how this person thinks, how he responds to a situation, how he responds in stressful situations.
Okay.
Like for example, there is a guy in LVP, Dr. Sayan Basu, who was my fellow, and I was very passionate about ocular surface. So he expressed interest that I want to join this field. I made every effort to make sure that he comes on board. Even fighting with my top management, sending him out of the turn to for doing a stem cell research training in US, and bringing him before I leave. Because my idea is that I want to create a system in an institute. Whatever I created should stay back. It should not go with me.
Since you picked up this point on stem cell system, you are a pioneer in this. You've done a lot of research and you've treated a lot of patients. You want to call out few thoughts on this?
Well, this was again a need of my patients, and how it happened was when I came back from Harvard in LVP, there were 6 cornea doctors. All of them looked at me and they say, "आप क्या करोगे? हम तो सब कुछ कर रहे हैं." Then I said, "Anyway, whatever the patient that you think you don't want to see or you think that nothing can be done, send to me, and I will not do anything which you think it is yours. I will not step on your toes."
Oh, okay.
And from that time onwards, what I got, patients with chemical burn, very severe complicated patients like Stevens-Johnson syndrome, and I developed treatment around them. And I have never done kind of things that other doctors do, whether like refractive surgery.
So doctor, you have a great knack, right? You picked up gaps, which you gave an example of a rheumatologist sending the patient to an ophthalmologist. You picked up gaps where when you went to Harvard, you wanted to learn something and come back. You've come back and you've again spoken to the cornea specialist saying, I will pick what you don't want to. So there is a whole new wave of treating patients that you have created in your own way and made a difference to the society. You may have got backlashes. You may have been told that this may go against you. How did you handle some of these thoughts?
Well, that's part of it. What happens is, like, for example, when I was doing stem cell, when I was about to start, almost all cornea doctors in LVP told me these things don't work in India. Then I said, okay, even if it doesn't work, I will try. And if I fail, I'll come with you. If I succeed, I will move on what I want to do. So similarly, when we started doing the stem cell cultures in LVP, internationally, everybody criticized me. They said, no, you are using only a single layer. Everyone does multi-layer. And the fact of the matter was, I did not get multi-layered because I didn't have good resources. So we started using monolayer. And today that is the standard of care.
You've also built standards while you have treated. And I did read this about monolayer, and we know that not 100% treatments go right. Still in the process you have learned and you've worked on many publications. Do you want to call out this process of innovation, treatment, and then publications? How do you connect these dots?
See that this somehow from very beginning I have this sense that, okay, if you're doing something, you need to create evidence. Means you need to publish in the highest possible way. Right. And with a good evidence, with high integrity, and then let people know that this is possible. So that is your publication. So I don't publish just for the sake of publication, I publish what I do.
Right.
So it is very important to have that realization.
So doctor, also this that you've been really humble that you don't want to leave a legacy in your name. You say, if my team is done, let their name be there. My name is there or not there doesn't really matter. What matters is that the patient's eye has been there the way it needs to be. What also matters is who's treated, who's learned how to treat better, and you have multiple hands who are now learning and doing the difference to the society. So from where does this humbleness come? I know asking you, but it's important, right? As a doctor-patient relationship, some of these value systems, if you want to call out some of these to a young ophthalmologist.
See, this must be around 2004 or 2005. At that time, our work on stem cell was at peak. And always in media, newspaper, TV channels. And many times it would happen that I'm operating and my team gives interview and my name is not mentioned. So one day, one patient brings a cutting and he says, "Sir, आप तो बोल रहे थे कि आप कर रहे हो, लेकिन इसमें तो आपका नाम नहीं है." Then मैंने बोला कि नाम में क्या है? काम तो मैंने किया ना, आपको पता है. And after that, I said that sentence. I felt so relieved. I said, "Oh, नाम में कुछ नहीं है." मैंने कहा, ये तो न्यूज़पेपर है, कल को रद्दी में चला जाएगा. And from there, I started working on my idea that why do I get attached to the name? Is there really, does it matter? Or the team is bigger and the patients are much bigger. So I from 2004 to I started working on this idea, and I tell you, it's such a liberating thought.
Great. So your most recent work on 3D corneas, how's the future of this with young ophthalmologists, if you wish to share?
Well, this is like a visualization that I have been doing since 2014, 2015, and we think that there is always shortage of donors, and if we can grow the cornea in a petri dish, make in the lab, scale it up, and then use a material in a way that you can make it 3D printed, you can use as a liquid directly on the patient eye, and it will take the shape of what the disease is. So I think that dream is about to be realized in next few years.
So where do you get these ideas, doctor? It's not easy, right? You talk about engineering thought processes, you also talk about 3D printing, you talk about multiple innovations at the same time. Do you read somewhere?
No, I don't read. I read a lot. I read different kind of books, different kind of authors. I listen to TED Talks. But these ideas come from my patients. Okay. Those, when I face the problems, I say, how do I solve a particular problem?
So, while there are many ideas that many other doctors may be getting, there should be some kind of motivation for you to pick that and go deeper into it, to excel and solve it permanently. What is that motivation?
I think most people are not able to understand that they get attached to their idea. That idea does not come out. They think that if I share, somebody will steal it, and somebody will work on it before I work. I think that's one of the biggest fallacy.
Oh, okay.
So if you have an idea, either you work on it or share with someone.
Right.
If it is good enough, it will survive. If it's not good, let it die.
And if it dies, maybe it's a failure. You also discuss with few colleagues and try to figure out.
Idea is just like idea is a possibility. No, if the possibility is over, another possibility arises.
Great. So we talk about possibilities, and let's converse more with doctors in the coming episodes. Thank you so much. Such inspiring insights on innovation and persistence. Next time, we will explore the other side of mentorship, colleagues, mentees, and how networks shape medicine as much as science itself.